Kbrh Health Foundation is fundraising for a $400,000 endoscopy campaign, which will support gastroscopy and endoscopy procedures at Kbrh, including those performed at the colorectal cancer screening program. Our regional endoscopy program services all communities across the Kootenay boundary.
So this is an important initiative that the Kootenay Boundary Regional Hospital Foundation has undertaken to raise money to purchase more endoscopy equipment for the Kootenay Boundary Regional Hospital. One of the benefits of this new technology is that we are able to screen for colon cancer much more effectively now than we ever have been before.
Buying new upper and lower endoscopy equipment now gives us information that we couldn't have had 20 years ago. We have much more clarity. It's just like your high definition TV at home. We can see much finer detail than we could in the past, and because of that we're finding illness at a far earlier stage. Really important when you talk about screening colonoscopies. We're looking for tiny polyps that are 1 millimeter or 2 in size. We may not have seen those polyps 20 years ago with with the old equipment.
The endoscopy clinic operates 5 days a week, and our team of general surgeons performed 2,500 procedures last year.
The endoscopy program at Kbrh is essential to investigate symptoms of the gastrointestinal tract, diagnose and follow patients with inflammatory bowel disease, diagnose and treat acute gastrointestinal hemorrhage, and it's very important for screening colorectal cancer in our patients.
Your support will ensure first-class care continues for patients throughout the Kootenay boundary using modern, state-of-the-art equipment. Gastroscopes and colonoscopes are the fundamental basis of this service and cost between $38,000 and $45,000 per scope.
So if you'd like to see how your money is being spent, I'd like to show you what a colonoscope looks like. You can see this is actually an incredibly intricate machine here with fiber optic display. There are multiple wheels that we use to tilt the colonoscope, to curve the colonoscope to allow us to negotiate corners in the colon. You can see it's approximately 2 meters long. The colon is generally 1.5 to 2 meters in length. And so we try to look at the entire colon to examine for any polyps or even early colon cancers that we can identify.
A $40,000 cautery machine will be purchased, which helps to stop the bleeding in the colon and gastrointestinal tract in an efficient and effective manner.
The new cautery unit will help prevent and control serious gastrointestinal hemorrhage in our patients. Certainly a significant improvement for, again, our endoscopy service here.
A high-definition tower with light processor and screen ensures that the images seen by the physician are the best possible to assist him in making a diagnosis.
As we get more high-definition equipment, we're seeing things that we couldn't see 20 years ago, and I tell patients that a colonoscopy in 2017 or 2016 is not the same as a colonoscopy 10 or 20 years ago. We see things that we never would have seen 10 or 20 years ago, and if you see them earlier, it's easier to eradicate things earlier, and when you eradicate things earlier, patients have a better outcome.
The importance of maintaining a sterile, clean environment cannot be overstated, and through this campaign, a flexible endoscopy cleaning system will be purchased.
Maintaining a clean endoscopy unit is of paramount importance. These scopes are expertly cleaned between uses. If they're not expertly cleaned between uses, there can be adverse outcomes, and the more up-to-date the equipment, the more confident we are that we're providing a high-quality service.
Specialized cabinets and storage tables for the scopes are a priority item for this unit.
Endoscopy equipment is kept in a cabinet when it's not in use, much like your lawnmower is kept in your shed when it's not in use. You wouldn't keep your lawnmower sitting in the middle of your backyard, and that's why we keep the scopes in these fully protected cabinets, and an update to that is sorely needed. After we're done with the scopes, up till now we've put them on a table in a Tupperware bin, and we've all seen that Tupperware bin hit the floor, and that's usually a $20,000 to $50,000 instrument that now has to be repaired.
A new patient monitoring system monitors patients' condition before, during, and after their procedure to maintain the absolute safety for a patient. Kootenay Boundary Regional Hospital is the designated site in the Kootenay Boundary for the BC Cancer Agency's colorectal cancer screening program. Colon cancer affects 1 in 6 British Columbians. Colon cancer is easier to treat when found at an early stage. With early detection and treatment, survival rates are approximately 90%.
So many people have heard of the BC Cancer Agency screening program for colorectal cancer and FIT testing. The FIT test is a highly sensitive test for blood within the colon. This, if positive, would prompt a colonoscopy and early detection of small lesions that, if left untreated, could develop into a cancer.
The general surgeons are supported by an amazing team of nurses and technicians, and together they provide an exceptional level of care for patients.
I'm very proud of our endoscopy unit and our expert staff. We are forever grateful to the residents of the Kootenay Boundary for their ongoing generosity and support of Kootenay Boundary Regional Hospital Trail. Thank you very much.
Your support will ensure that first-class patient care continues using modern, state-of-the-art equipment. Thank you so very much for your generous support of the Kbrh Health Foundation and the endoscopy campaign. We have raised $295,000 so far, and with your support, we look forward to completing the endoscopy campaign by the new year.
So the bottom line, no pun intended, is please support the endoscopy campaign at Kootenay Boundary Regional Hospital.